Hello everyone, so welcome to my YouTube channel Physio's Healing Touch. So in this video, I am going to tell you how to assess coordination of the patient. So to assess coordination, we have to check two components. First is non-equilibrium test and second is equilibrium test. So in this video, I am going to cover non-equilibrium test and in my next video, I will cover equilibrium test. Because non-equilibrium test is done first in the patient and then equilibrium test is performed on the patient. So basically in non-equilibrium test we do reciprocating or alternating movements like pronation, supination or finger to nose test. So these all are reciprocating or alternating movements to assess accuracy of the movement in patient. So by doing all these movements we check how accurate patient is performing that particular movement. So these non-equilibrium test is done to check the accuracy of movement in the patient. So non-equilibrium test is basically done to check the fine motor activity of the patient. Fine motor activity means movement done by our small muscles like muscles of our hand, fingers. So all the movements that are done by our hands is considered as fine motor movement, whereas equilibrium test is done to check gross motor activity of the patient. Gross motor activity means movement done by our large muscles like quadriceps, calf muscles. So running, jumping, all these considered as the gross motor activity. And equilibrium test, which I will tell you in my next video. So equilibrium test is done to check the gross motor activity of the patient. So non-equilibrium test in the patient can be checked in lying position or sitting position. So now let's start the video. So first non-equilibrium test is finger to nose. For this the shoulder will be 90-degree abducted and elbow will be extended. And patient will touch the tip of the index finger to the nose. This can be progressed from unilateral to bilateral. And then you can ask patient to close the eyes and perform the same movement. And you can also ask patient to perform with high speed. So speed can also be altered. And then you can ask the patient to slow down the speed and watch if there is any shakiness or incoordination in the movement. Now suppose a person has tremors. He has intentional tremors, also known as action tremors. That means when the patient will be performing this movement, there will be shakiness in his hands. As you can see in this video, there will be shakiness in the movement. Now next is finger to finger. For this the shoulder will be 90-degree abducted and elbow will be extended. Then ask the patient to bring both the hands towards the midline and touch the tip of the index fingers of both the hands. You can also ask the patient to increase the speed to check the coordination or decrease the speed. Now suppose a person has dysmetria, which means inability to predict or judge the distance. Then due to this, the patient will be unable to stop at the required point, as you can see in this video. Now next is alternate nose to finger. In this the patient will first touch his nose and then the finger of the therapist. Therapist can also change the position of his finger. Now next is finger opposition. In this patient will touch tip of his thumb to each and every finger. So he will perform it like this. You can also ask the patient to increase the speed. Now next is mass grasp. In this, patient will alternately open and close his fist. So there will be full finger flexion and extension. Next is pronation and supination test. For this, shoulder will be 90-degree flexed and elbow will be extended, and ask the patient to perform rapid pronation and supination. Now, if a patient has dysdiadochokinesia, that means inability to perform rapid alternating movements, then he will perform pronation, supination like this. They will be in coordination and he can't able to perform rapid movements. Now next is rebound phenomenon. In this, the elbow will be flexed and therapist will resist elbow flexion in order to produce an isometric contraction. And then suddenly he will release this resistance. In normal patient, there will be no overshooting of flexion movement because opposite muscle, that is triceps, will stabilize the movement. But in case of cerebellar lesions, patient cannot control this movement. I have put my hand in front of patient face so that he doesn't injure his face. So when I will remove the resistance, there will be overshooting of flexion movement. Next is tapping. So for this, the elbow will be flexed and forearm pronated. Then ask the patient to tap on the knee. Therapist can also alter the speed by increasing or decreasing the speed of the movement. Now suppose a patient has bradykinesia, that means slowness of the movement. Then when we will ask the patient to perform tapping, then slowly his speed and amplitude of the movement will decrease, as you can see in this video. Tapping can also be performed in the foot. In this, heel will remain in contact with the floor and the ball of the foot will tap on the floor. Now next is pointing and past pointing. Both therapist and patient shoulder will be 90-degree flexed and elbow extended. Patient will touch the tip of his index finger to the therapist and then fully flex the shoulders and then return to the original position. In abnormal response of the patient will unable to stop at the required point and there will be past pointing. So as you can see in this video, when patient is bringing back his fingers, there is past pointing. Now the patient will be in supine position and he will perform alternate heel to knee or heel to toe. If patient is unable to perform this movement accurately, then there will be mispositioning of the heel, as you can see in this video. Now next is heel on shin. So patient will be in supine line and he will drag his heel on the shin of the tibia. Now next is toes to examiner's finger. So the patient will bring his great toe to touch the examiner's finger. In this, the therapist can change the position of his fingers. Next is drawing a circle. In upper limb, patient can be either seated or standing and he has to perform an imaginary circle. In lower limb, patient will be in supine line and he has to perform an imaginary circle. Now last is holding a position. So for upper limb, the patient will flex his shoulder to 90 degrees and hold this position. If patient will have postural tremors, then when he will hold this position, there will be tremors because patient will unable to hold this position against gravity. Because this is against gravity position and patient will unable to hold this. For lower limbs, patient will extend his knee and hold this position. So yeah, it's done and I hope you like my video. If you liked it, then please like, share and subscribe to my YouTube channel, Physio's Healing Touch.